So hello everyone, today we're going to talk about the healthcare in Ukraine, and we definitely do the overlook of the situation. We'll speak a little bit about the political reforms that were happening in the field of the healthcare and they were considered to be one of the most important reforms. We'll also touch the question of the COVID-19, and we will talk a little bit about the expenditures structure and expenditure system of the healthcare. So let us jump in. In general, we use the same metrics as we understand the improvements or the faults in terms of the healthcare, and definitely the major issue is, are we doing our life better, are we living better through the years? And if you take the life expectancy, you can see yes, so we have this improvement comparing to the 19th, but actually if you see the results, you can see that almost in 20 years these improvements are not so rapid. So we can see here in 1998 it's almost 68.5 years of the life expectancy at birth. Yes, but comparing with the 2018 or 19, you can see 71.5. So it's naturally means that the major improvements is in 3 years, while in general world made an improvement in 7 years. So we are doing almost half what usually world is doing. But if it compare with the other countries, yeah, we are doing the same as world right now. However, comparing with the more developed countries, we can see that they have life expectancies that is higher and higher. And definitely Japan and South Korea are pretty good in these terms. But what is interesting here in terms of life expectancy, that we have a gap between male and the female population. You can see on this chart that actually the average life expectancy of men is near 67, but the average life expectancy of women is 77. So almost 10 years of difference. This is tremendous task for the governments to get out of this gap, because it is not good in terms of the demography, but also it can do harm in terms of the social security, as definitely in average when men or women are dying, someone of the group, let's say from the one family is dying earlier, it simply means the opportunity to live together, but it's also the additional the additional additional problems in terms of the keeping this person, only one person fit. So this is additional push for the families to cope with that. Well, for example, the retirement infrastructure in Ukraine, as we may know, it's not so developed comparing with the other countries. So it causes a number of the social problems just having this gap. But you know that one of the main issues, it's not only a life expectancy, but actually the healthy life expectancy. And here we can see that probably no dramatic shift was done since 90s. So probably 1 year added, and in general you can see that this line between healthy life and expectations and life expectations, that is probably 10 years difference, has not changed at all. And then simply means that in terms of the social security, in terms of the happy and healthy life security, we are not doing better in this more than 20 years perspective. That is really sad. So we are almost keeping the same level, while taking into account different different data. For example, I took here the global graph, and they do some prognosis for the future, and they pretty show that we will have the natural increase of the life expectancy, pretty the same as in other countries. But look here, 10 years in almost 70 years. This would be below average growth comparing to the world. And that, once more, that means that we are not doing fantastic steps in Ukraine in terms of the health and social security. And this is quite challenging for the future generations, because even now, once more, Japan or South Korea are doing almost this 83 years right now. So this is a danger of the overaged population, but this is also a danger that you're not doing enough, like to make your life of your citizens longer. And once more, in terms of the healthy life expectancy, the situation is much more worse. So yeah, so this brings us to the issue of the burden of disease. And you remember that it's actually the number of years that is stolen because of the permanent premature deaths, or for example, because of some disabilities, and the people are using disabilities. And comparing with the other European states, Ukraine is actually having one of the worst situations. So usually we have like this in 2000, at least in 2017, in 2018, we had almost 36,000 of years per 100,000 of individuals from all the cases. That is pretty a lot. That means that you have a danger to live with disability or to die before you become mature, before the natural death, like in 3 times more comparing to the schedules to the normal situation. So actually you can see that the majority of the European countries that they have average like near 10,000 or 20,000. So we are doing much worse here. Well, the burden of disease and the daily amounts has also decreased in Ukraine since 19th. That is a good sign. However, once more, if you look comparing to the European situation and comparing to the worldwide situation, so we do not have tremendous improvements. So we are pretty the same stable level as we were. And that is very sad, because this risk, 30% more risk for the younger generation is pretty high for the even for our class, even for our middle and lower income country. Well, you see, for example, that world is doing almost the same, and Eastern Europe is doing almost the same. But for example, developed countries as United States or United Kingdom are doing much more better. Yeah, and the reason for this is definitely different diseases that we have and the probabilities to be injured that we have here. So first we should state that in terms of the child mortality, that we had the pretty high percent in the 70s and almost 2% at the 90s. So now we have lesser than 1%, and indeed this is tremendous shift, because as you may remember, actually the neonatal fatalities are one of the major group of the injuries or life diseases, let's say, in the group of countries that are low middle income or low income countries. So we are just run away from this trap. However, that's still present. And here you can see how the situation was changed. And you probably see here by the reasons of the diseases that actually non-communicable diseases are much more popular here in Ukraine comparing to the other kind of diseases. Well, for example, the injuries or communicable diseases are still present. The number one you can see is cardiovascular diseases, and this is the same that we had a few years ago, yes, and neoplasm or for example, muscular diseases or other non-communicable diseases are still present. Well, what is interesting here that pay attention on the HIV and AIDS and tuberculosis growth, and this is one of the most challengeable issues here here in Ukraine. But also, what is interesting here that not seriously, but nevertheless, the for example, the violence and self-harm injuries were also increased. Yeah, so if you take the numbers, and if you once more used the daily system, you can see that indeed the cardiovascular diseases, heart diseases, and cancer or unintentional injuries is the highest group in the Ukrainian societies. And actually, take into account the cardiovascular diseases, we had the worst situation not only in Europe but comparable, because we have the worst situation in the world. We are not the number one, but we have this trouble as one of the main troubles in the structure of diseases that that we have. And what is interesting here, so if we take the non-communicable diseases, you can indeed see the same story, that cardiovascular disease is pretty on the same level comparing to the 90s. So it doesn't go down. While, for example, we have cancer level that is pretty the same in the structure, and we also have these neurological disorders, and we have the digestive diseases that are a little bit increasing. What in terms of the communicable, in terms of the sorry, there is some troubles. Yeah, in terms of the communicable diseases, you can see that that indeed we have like these troubles in terms of the HIV and AIDS that is increasing in the recent years. And actually we also have the a little bit decrease in the neonatal disorders. However, in the structure of diseases is pretty high. Well, for example, diarrhea or different respiratory diseases or infection diseases, the level of them was pretty the same. However, it's for 2016 on this of this map. We can take right now the COVID cases, and it will be a little bit higher. What is interesting here is that actually this is not the structure of these diseases. It's not only for elders, as many people think. So you can see that almost 30 and something percent, there is an average number of diseases for all the groups. So that simply means that we do not have the group with almost all problems, even more. So the structure for the elders 70 plus years is much more lower than comparing with the 50s or 69 years old, or even comparing with the just adult population starting from 15 years and more. And this is rather dramatical, because it simply means that we are losing like a power as humans, as citizens, not in the older age, but rather in the more younger age. And that is why it harms not only the social conditions that we live in, but also the, for example, the productivity of work and the other issues. If we take the number of cases, because that was daily, but if you take the number of cases that brought to death, you can also see that the cardiovascular diseases and cancer has the majority of cases in Ukraine. And almost the top, and the top is for the heart diseases. And even now, if for example you take like this COVID cases that mainly around 2000 and something in Ukraine, you can see that the level of COVID, it's near the level of the kidney disease or diabetes, but the cardiovascular diseases are still the major group, and the same situation is kept for the last 10 or even more years. And here we can also, if you compare like these top groups of the diseases, you can see once more the same issue. Despite time is passing, and we had this time that we could spend for improvement of the situation, but actually no GDP is per capita is improving, and in terms of the diseases, we have almost the same as we had at the beginning of the 90s. It's good that we decreased a little bit in terms of the cardiovascular, but comparing with the world, or even comparing with the situation in Eastern Europe, we have much more harmful situation in terms of the heart problems. The same story with cancer. A little bit. So in Ukraine, as you may see, we were doing a little bit better than Eastern Europe and better than the world. But unfortunately, in the recent years, we have this increased number of the cancer cases and also cancer deaths. And that is why it's like the second group. Tuberculosis was considered to be one of the tremendous problems in Ukraine, especially at the beginning of the new millennia. Probably you can remember that. And now we can see the little bit decline of that. But once more, comparing with the 90s, we doesn't succeed in terms of doing the tremendous shift to the better conditions. So almost the same level. And right now we have the death rate that is much more larger comparing with the Eastern Europe. So sorry, but not much more, but larger a little bit comparing with the Eastern Europe. However, we have much more better conditions comparing with the rest of the world. But once more, no major improvements. And in terms of HIV, as I told, and as we see, it's shifting and it's growing rapidly in Ukraine. So here you can see the number of the infection cases that have happened in Ukraine. You can see a little bit decline in 2014 and 2015. Actually, that was result of the Russian annexation of Crimea and Russian annexation at the Donbass, because this oblast, this region, were not taken to the account in the later data, and you can see nevertheless there is a growth, overall growth in Ukraine with this HIV and AIDS infection. So even to the number of the international organizations reviews, Ukraine unfortunately has a leading position in Europe in terms of the HIV growth, and this is one of the serious problems here. So we should take into account that in the number of the cases, we don't have the tremendous improvements with the public health, and it is one of the bases yes, of the social development. And even here, if you take the Sustainable Development Goals, UN Sustainable Development Goals, and Ukrainian strategy of the Sustainable Development Goals, Ukraine considered public health as being one of the most important actually goals that will influence the development of the others. And here you can see, if you take the one of the latest voluntary reports that was done by the Ukraine nationally, we can see that we have different targets and groups that are doing much more better, but we can reach them in 2030. But also we have unfortunately a number of different targets, concrete targets, that we probably will not reach in 2030. So let's see what we have there. You can see that, for example, in AIDS and HIV, there is a danger in our growth. I'm not talking even about like doing the benchmarks of 2025 or by 30, but even by the numbers here, you can see that we are growing, and we are growing rapidly in terms of these infections. But nevertheless, we succeed to decrease a little bit the deaths from the non-communicable diseases, and we can see the decline of the mortality rates. And especially, for example, really great push in terms of the cerebrovascular diseases, while, for example, the other issues are still important here, and we probably will not meet the benchmarks, for example, in terms of the malignant cervicular tumors. Yeah, but what is also important here, that we see this probability of the dying at the age of the young age, let's say, of the working age of the man, that is really, really high, and actually that caused this gender gap in terms of the life expectancy. And we put here the target that we want to reach, but you can see that a lot should be done. Also, in general, Ukraine has done a pretty good job in terms of the decreasing the deaths from the road traffic accidents, and this is once more one of the effects of the policies that was done in terms of the police service. But nevertheless, we can see that still it is an issue for us. And in terms of the other diseases, but the popular diseases that we have in Ukraine, so luckily we can see that we have increased of level of immunization. That simply means that we have more vaccines that people are doing in the recent years. However, there is also a tricky situation, because you probably remember that was a number of states when they faced the problem of the healthcare knowledge by the citizens, and the number of the cases when people simply refuse to do these vaccines, and they refuse to make them obligatory. We have the same story in Ukraine. However, nevertheless, luckily, if you take like this overall situation, we can see that the data for the vaccination is improving. Yeah, and the other issue from the targets that we put according to the SDG is actually the reforms of the healthcare financing. And here you remember that in the developed countries, the majority of the healthcare expenditures are done by the state, as it is one of the basic obligations of the state to secure this field. While, for example, in Ukraine, it's quite challengeable right now. And also smoking is widespread in Ukraine, and you can see here that we are not sure, and probably will not come to the to the data that we want to have, to these targets that we put it, especially in terms of the women who smoke in the younger age. So these are these indicators, and there are many others, but these indicators are included into the Sustainable Development Agenda, and yeah, you can see that while we are doing some improvements, but nevertheless, it still is quite challengeable, and indeed it requires a good system of healthcare, good policies of the healthcare, because this is a basic of the social and economical improvement of the country. So if we do a very little follow-up of the Ukrainian conditions, definitely I'm not touching other diseases, but if you are interested, you can see them. There is a lot of data of the World Health Organization, and it's pretty open. And luckily, Ukraine is in the number of the countries that has the open data obligations, and so we can do observe the situation from year to year. But in general, we can see that the life expectancy and at birth and health life expectancy has increased, but however, this is not the great increase. It's like only 3 years through the last 20 years. There is a gap. We should talk a little bit about the life expectancy and healthy life expectancy, and it is increasing a little bit, but it is increasing. That simply means that we do not have the overall infrastructure of doing our life and health better. Then we also have this gap between male and female, which is quite dangerous, mainly because of the productivity of young male population, but also for the social conditions that are happening after their death. In terms of the total burden of disease, there is no dramatic change at all. So a few probably percents. Well, in the world, it was like 4% decline. And once more, this is how the healthcare system is operating in Ukraine. But we have some of the good steps, like decline in mortality of children under 5 years, once more because of the introduction of the modern technologies, because of the creation of this network of the perinatal centers. And this is good, because in the majority of the middle low and low countries, neonatal issues are in the top list of the fatalities. It's not on the top for Ukraine. However, in the structure, you can also see that it is present, and pretty high present in the structure of deaths. Also, we have the decline in the number of cases in the maternal mortality due to the infrastructure that was recently developed. We also have the decrease in number of patients they are diagnosed with active tuberculosis, and this is probably because of not because of the infrastructure improvements, but rather than using the World Health Organization recommended treatment regimes, and also because of the improvements in terms of the tuberculosis drugs. So here, not infrastructure was moving, but rather the approaches to how to treat that. Also, we can see the reduction of numbers of deaths from the cerebrovascular diseases. And this is because of the national action plan that was actually developed in the 2017 for the non-communicable diseases that tries to eliminate the risk of the cerebrovascular diseases, such as, for example, tobacco smoking or alcohol abuse, or unhealthy diets, or like poor physical activity. However, we can see that, for example, in terms of smoking, this plan is not implemented greatly. Yeah, and we also have this decrease in the number of deaths from the traffics and accidents. However, we have increase in the HIV positive results, and this is very serious risk for the country at all. Yeah, so the reason for this not improvement is actually both infrastructure and the expenditure system, but also the public knowledge and public behavior in this field. However, if we judge and if we take into account the expenditure system, we can see that in theory, if you are investing in the field of healthcare more and more, then you'll have better results. So there is very deep correlation between these two fields. So what we have in terms of the expenditures, of the public expenditures, let's see a little bit data. It was for 2017. Many updates are still to become, but in general, we are spending almost 7.6% of our GDP for the health expenditure. And these are all types. So private, public donors, and other type. While, for example, public health expenditures are near 45%, yes, and once more, we know that in more developed countries are spending more, so states are spending more. And if you take the expenditures by per capita, it's only $200 US, and this is very dramatic because we can see, comparing to the highly developed countries, that they are spending much more. So that means that they simply have money for better solutions. Unfortunately, we don't have them. We also have near 16% level of the catastrophic health spending. That means that these are all types of these injuries, but also it should be taken into condition that we have war at the eastern part of Ukraine. So that's definitely there is why we have this catastrophic health spendings that are higher comparing to the other stable states that are not witnessing war. But what is interesting that according to the respondents, according to the data, 92% of Ukrainian, they fear financial catastrophe because of the health-related problems. So despite we were talking that this is a state obligation and the majority of cases with the free medicine that we have according to our constitutions is paid by state, nevertheless, to some extent this is political myth because yeah, we have data that people fear financial difficulties for that, and the amount of this is much more higher. It's near the same as the countries that predominantly private insurance have. Yeah. So so yes, what we have here actually, this is in general what we have in theory, what we have like classically, the behavior of the low and medium income countries. So we can see here that in general, it's near 45% and the same. We have 45% of the state, for example, of the government expenditure for the health system, while once more in high income countries, states are spending much more than $200 per capita, and they are spending more, so more than 60, near 70%. However, it's good that we don't have like this low situation as in low income country, but we should do much more better, like to join the group of the upper middle income. So we are stable, classical, lower middle income country, and actually our structure of the health expenditures is the same as in classics we have in that group. That is also sad. yeah, if you take the health expenditures, once more the chart is out of date a little bit, but nevertheless you can see that almost no great difference comparing with the 90s. Near 70% of the GDP is spent, so we are not improving our situation dramatically. And in terms of cost, $200, and you can see that in 95, for example, in 90s, it was almost 100 and something. Yes, it increased because the situation changed and the dollar rate changed, but nevertheless not major improvements, even comparing with the Central Europe and Baltics, and even comparing with the rich and developed countries of Western Europe and, for example, United States. Here you can see the huge shift. Yeah, and that's definitely because the structure, not only because of money, but also the structure, how you spent this cost was formulated in Ukraine. So this structure, if you can see by the majority of the European countries, the family doctors has the 30% presentees within the primary level of the healthcare. While in Ukrainian case, the majority of the financing of the primary level was in the hospitals. This was one of the challenging issues before the healthcare reform started in 2017. Sorry, that actually tried to change a little bit this situation, because in this type of the economy, that simply means that hospitals, they have all the money and they have all the power, and the power is issued for the development of the hospital, the development of systems. That's definitely good, but in terms of the finances, of the targeted finances, that are really better, because if you need some trouble, you can have like targeted help. So we were not doing pretty good in that sense. So this was one of the challenges of transforming the system, because we simply invested into the hospitals, and the director of the hospitals has the right to do whatever they wish within this money. And it's usually, as you can see, the expenditures were not so high, so they were always lacking of money. So there was a greatest challenge in terms of the accessibility to the medicine. While in general, we proclaimed that our medicine in Ukraine and our system of healthcare is open, is free, because the constitution instated that. But nevertheless, access to medicine or to cure was very, very limited because of the unproportional spendings within this structure. Health infrastructure is really important for the development of the healthcare system, because this COVID-19 case is the better case to show that, because you can see how the different countries behave, take into account their ability to cure and to host people that they are infected. So it's very classical thing. If you have lower number of beds that you can have that you have to accommodate patients and in different clinics, and if you have the lower number of the medical entities, that simply means that you can accommodate and cure lower number of people. So in general, if we take this 2017 years, 2017, we have almost 2,000 of medical entities in Ukraine, and additional 10,000 polyclinics. That is pretty enough. So take into account that the majority of them were built in the Soviet times, and when the number of people that were living in Ukraine was much more higher, so now the population is declined. So the infrastructure itself, if we count like building by building, is pretty huge. But also the expenditures are huge for this system. While we also have this inequality issue present here, because the majority of these facilities are located in the cities. So in general, the infrastructure is not built well in terms of the contemporary needs. And what we have in terms of the beds that could be used to accommodate patients, you can see that we have almost 3 beds per 1,000 of people, and within this rank we are doing pretty good, much more better than the majority of the developed states. However, so you can see Germany or Lithuania and Poland or even Czech Republic that are doing much more better. However, there is not clear correlation that if you have more beds, that simply means that you will treat people better. So you should take into account the professional level and also the infrastructure, the level of infrastructure, the quality of services that are done. But it somehow explains, for example, while Germany was not doing like the very strict shutdown for the longer period of time, because simply take into account their population and their expenditures, they can pay for like staying in the shutdown for the shorter period of time. And we know probably that Germany was first to close, like to introduce the quarantine, but it was one of the countries that actually opened their facilities and their economy very, very, very promptly. That because they have this critical infrastructure that could be used in terms of the people secure, and later they see if the COVID is not bringing like danger to the critical infrastructure, that simply means that they can cope with that. And like, for example, Ukrainian situation, when take into account the correlation between the number of the beds and the number of the facilities with the growth of the COVID cases, we can see that it is unfortunately challenge for the critical medical infrastructure in the number of the regions. And here that there is why, for example, for this red zone regions that we have usually the level of the people present here in the clinics and in the polyclinics it's really, really high. Okay. But also, besides money, besides infrastructure, we also have the issue of the health, public health knowledge of people. And here I just want to reflect a little bit that despite we can see that in general, our situation with vaccines were improving. However, we also had these troubles with the measles vaccines. And a few years ago, there was a big shock that Ukraine was one of the mostly infected countries in Europe in terms of the measles vaccination coverage, because people were and parents were not using that, so it was really dangerous, and it was not pandemic, so it was not even epidemic in terms of Ukraine, but it caused the low level of the vaccination for measles caused very dangerous spread of this disease. However, it was located in the few region, but since that time, since 2018, it renewed in its obligatory status, and there were a lot of protests from the parents. However, now it's obligatory for every kindergarten or every school to take young child only if they have different kinds of vaccines. So that is why you can see that a number of the cases, they are much more structural, but also behavioral. in terms of the vaccination, but that there was a tremendous need of the healthcare reform in Ukraine. Why it was needed? Because mainly of the three political myths that that were affecting this situation. So the first myth was about very successful Soviet free medicine. Once again, according to the Ukrainian constitution, everybody has a right to free medicine, but it was not free at all. 85% of the medical institutions were state-owned. That means that they were free of charge. And once more, we have the general spendings of around $200 of US dollars, but they were mainly done from the pocket. And nearly 15% of the medical institutions were private, but only 20% of Ukrainians can afford this private medicine. So even here we have this inequality issue. However, we see that in general, state was spending near 45% of the general expenditures for the healthcare. And as I told, there was such danger and always problem with the cost distributions, and the budget does not have funds was a very popular phrase in the majority of the clinics when you come here. That simply means that there was, and to some extent it is, the huge danger of the gray medical economy. If you come and you have a right for the free medicine, but if you don't have budget for that in the clinics, they simply mean that you had to buy this medicine by your own. But in terms of the cure process, that simply means that you were witnessing a number of the bribes. So the corruption issue was indeed very high. Or for example, some charitable donations to the hospitals if you want to be cured, and so this great medical economy was still present because people simply do not have access to the information what was done by clinics, by the director of these clinics, by the general doctor of these clinics with the budget. So you don't have access to that information, and you simply, if you're coming there and the doctor is saying, so we don't have money to do I don't know, some cure for you, you have to pay. But what is tricky here, that in general public budget for healthcare is almost 2.7% of the GDP. It was in 2019. Well, people themselves paying out of the pocket spend much more for their cure. That means that they had the money, the resources for this issue, and there was practically no free medicine as it was proclaimed by the state. So this also system should be changed somehow, not to relate too much on the decision of the concrete doctor or the general doctor of the concrete clinic or institution. But also the system overall was inefficient. So predominantly doctors were not using international protocols and principles. Some of them, so it depends really on the doctor and it depends really on a clinic, but it was not like the rule, it was not obligation for them to follow that. And this simply means that the evidence-based medicine that is happening in every developed country was not also a case here in Ukraine. And there was always a danger when the pharmaceutical networks were collaborating with doctors, and that simply means that they were interested to sell more drugs, sell more medicine, and they were paying doctors, and the doctors were simply curing you with a number of different medicine, and you simply don't know if you really need them or not. So all these steps And all these troubles and all these myths were really preconditions, take into account also developments in the public health. Yes, the growth of our better and healthier life were preconditions of the reform. And actually in the 2014, it was the first attempt to start it. It was Mr. Kvitashvili, so the former a former minister of health from Georgia, who was doing the reform, the medical reform in Georgia. He was introduced here in Ukraine as a minister of health, but unfortunately he doesn't succeed even to start this. Well, in 2017, actually, finally, there was a start of this reform, and you can see different phases, because it was like the reform developed for the almost four years. And the main part of this reform was actually the new mechanisms of financing health sector. So state thought that actually state concentrated and allocated money for the very specific needs of the patient, instead of just paying this money for the for financial all hospitals or doctors and inpatient beds. So this idea of money follow the patient was introduced. And secondly, this reform was introduced the position of so-called family doctor, whom the patient have the right to choose himself. And family doctor was the person who was observing families or like people, and who have the right actually to subscribe subscribe some medicines, but also have the right to subscribe the access to the other doctors. And the clear idea of this family doctor is that they can gather statistics, they can gather information from the concrete families or patients, so they have a look, they have full look on the patient, because before that you have this medicine card, physical medicine card that you have to bring with yourself, and whenever you can enter the clinic, nobody has the overall understanding what was happening with you, because no one was spending like years observing you. So this is actually how the this family doctor approach was built to play. And actually they used the data, and it was evidence-based, it was data-based decision, because nearly 80% of all cases that people witnessed, they actually referred to the one family doctor. So it has its logic. But also together with this, you see from the April 2018, this idea was starting. Also, the e-health system was introduced that should serve as like the state system, where all the information about the treatment, but also all the information about about the how the availability of medicine had to be. So, and that helped to implement the next step and the next logic, that a state that is really cut it of resources, because we are not unfortunately a rich state, was clearly defining the limits for each of the year that the state is ready and have resources to pay for. For example, they were covering like family doctors services, also the palliative care, some emergencies that happened with 100%. And then, for example, some other diseases, they could be co-financed, both by the insurance company or citizens themselves, or, for example, also by the state budgets. But the basic cure needs and also some special needs with for example, with the cardiovascular diseases, or for example, with diabetics, or the same important troubles that we are witnessing in our structure of diseases. They're also laid on the state. However, once more, state was not able to cover everything, and this was like the co-financial system, when you have the right to have an access to insurance, and insurance companies were paying. So it simply was, for the state, it was no need to invest in everything, but only on the very important basic levels. And finally, the Ukrainian doctors were obliged to work with international medical protocols. So, and they simply mean that they have to observe the clear rules, and they simply mean that they had to prescribe those medicines, for example, that were used by the and internationally recognized. So here they were killing this pharmacy lobby, so-called pharmacy lobby, that was paying to the doctors, that we discussed, was paying to the doctor like to sell their drugs. And we, until 2018, when the new government appeared after the elections, actually this reform was working according to the schedule. However, recently, the second phase of this reform, and it was the reform of the high quality specialized help of treatment in the hospitals, was stopped by the new minister of the healthcare, because there was much speculations about the danger, even the danger of this reform, and the logic of the development was not supported by the majority of the citizens. But actually, it was more about the miscommunication, and the major problem was because of the very huge lobby of the pharmaceutical companies that were not interested in this reform. Once more, because with these international medical protocols, they simply can't have negotiations, and they can't have deals with concrete doctors. They were prescribing only their medicine. There was also big oppositions from the leaders or directors of the clinical centers, because now they have to compete for the patient. That means that they need to have well-educated doctors, that they have to have real good services. So the person would like to come to you and to sign an agreement with you. And the major danger for them was of the very public presented expenditures. So, and here with the ability to actually to live in this corrupted system, when you can hide the public budget, you see, it was like simply killing their business. So that is why there was tremendous lobby how to stop this reform. So it was not killed right now, but to some extent it was stop of this second phase of the reform. Yeah. So what is here important to see, it's about how the reform moved, how this healthcare system of the services was introduced in Ukraine. So you can see that in 2018, the first step, mainly in the primary care, was introduced, and e-health solution was introduced to make the very transparent spendings in the medical sphere, and also recordings of the personal data was here introduced. While on the next phase in 2018, these specialized facilities for hospitals were practiced, and in 2020 they had to start it as a normal. So we understand that there is a primary care clinics, and these are specialized clinics. And the reform was introduced in the primary care clinics. They have to compete for the patient, and then the next step was for specialized clinics, for example, that they witnessing with heart diseases, or let's say with tuberculosis, and so on and so forth. Yeah, but for here it was stopped, unfortunately. And what will be the future of this reform? It really depends on the present government, and also on the people's support of this reform. But unfortunately, it was one of the political issues that happened. And the new government of the Servant of People Party was actually it was one of the points that reform was ineffective, partly because it was not finished. Yes, and that is why they decided simply to stop it. COVID case in Ukraine is actually interesting case, because it's not only showing like the spread of the disease, but for us, for political scientists, it's showing how the society and how the politics and how the policies and political system was ready to meet such challenges. So actually, you can see by this newly updated chart that the number of daily cases in Ukraine is increasing as of September 2019, and we don't have this tendency to have the U-type movement when we have the first move or the second move, and many people believed, and there are many arguments from doctors that actually the new wave is only going to happen in Ukraine in more closer to the winter. And also the number of daily deaths also increased. So for September, you can see that it almost reached 60 people per day. And the major challenge in terms of the COVID here was actually the critical infrastructure, the critical medical infrastructure. So the ability of the state clinics or private clinics to host people. That is why we can see that mainly in the regions where we have the higher level, so these red zone regions, we can see that these places, in the hospitals are really overcrowded, and that is a danger for that. While overall also, I do believe that later, when the COVID will finish and we will have vaccine, with that it will be possible to analyze the previous situation. But however, we can see even right now with the spread of this disease, that introduction of the shutdown here at the beginning of the March, together with the other European states that have much more higher number of the diseases, was not a clever decision, because 2 months of the quarantine, of the very strict quarantine, and then actually refusal to continue it, brought to the crash first of economy, but then it also brought the crash of the people support, that simply started to do whatever they wish. So the behavioral issue is still a part of that, and now you can see the rapid increase of the diseases. So, but with the population misbehavior, let's say that, you also see the serious troubles for Ukrainian economy. So in general, you can see that starting from the March, we have the monthly decline in terms of the GDP growth, and even to the 12% that was happening in April. So now situation is becoming a little bit better, but nevertheless, despite of the developments, we can see right now that by the end of the 2020, there will be from 5 to 7% of decline, of the economic decline. And different economies, they show that even the research data of OECD shows that Ukraine needs at least like 1.5 or 2 years just to come back to the point of the end of 2019. So this is tremendous crash of the Ukrainian economy. And even if you take by sector, what we have during this period of spring and summer of 2020, that we see a decline in the trade of the 20 and 30%, in heavy industry from 10 to 30%, in energy sector, in freight services, and especially in tourism, that completely was killed. And one of the troubles was also that the increase of the budget deficit, together with the decline of the GDP growth. It was also the deficit that, according to different estimations, will be near 5% of GDP by the end of the year. And this is tremendous, like, budget deficit. Even comparing with the previous years, there was only 2%. So, and there were a lot of expectations that this year before COVID will cause the rapid growth of Ukrainian economy. Unfortunately, no. So that means that simply we will recover ourselves for more than 2 years. And this is actually causing a number of challenges to the public health in Ukraine, because with the stop of reforming, because with the inability to invest more, and with the same level of the social development, with the same level of the public knowledge and the public expectations, we pretty can understand right now that we do not see the rapid possibilities of improvement besides the state actually policies that could and should be implemented, like, to help the situation. So it will not solve just because of the so it will not be solved just very naturally. So that simply means that the government should have a very clear position putting of the public health as one of the important tasks, as not of the primary task for the social development. So what are the challenges that we face right now? Actually, it's the finalizing of the healthcare reform, the implementation of this reform that should be done, because the system was changed and now it's in behalf. So that simply means that either the new health reform, the new logic should be introduced, or that simply that logic that was introduced by Uliana Suprun's ministry, and this is a logic of the European states, or let's say the North American states, that should be finished. Then the second challenge is actually underfinancing the health system. And once more, we see with the decline of economy, we don't see that we will have much more free resources to finance that from the state budget. That simply means that that idea of co-financing and the insurance companies' financing should be a part of the story. Then there is also a risk of the widespread self-treatment practice among the population. And according to the very recent sociological survey data, almost 70% of the sick people in Ukraine, they tend to cure themselves without going to the doctors. So this, I do believe that this situation will be changed because of COVID, and now more and more people are practicing to have a very great and good consultations with the doctor, because otherwise this simply means that after self-treatment there is a danger of growing number of different complications. And so more and more money will be spent, like, to do the full cure. Also, insufficiency of some pharmaceutical drugs that are sold in the market. Here is according so actually here is a danger. So if you don't use the international protocols of procurement, that simply means that you have the possibility um, to prescribe for the patient everything you want. Yes, just because you're a doctor, just because you have this you have this label. And according to the World Health Organization surveys, almost 10% of all medical products in low and middle income countries actually fail to stand the test, and they can't be used for effective curement. And due to this lack of the monitoring of the health monitoring system and of this e-health system, there is always danger of selling these pharmaceutical drugs in the market that can't help. So here state should be very serious player, because we can see right now that despite this is a socialistic position, but actually this is a task of state to regulate. Otherwise we can see the situation that was before the introduction of this reform. Then decline of non-communicable diseases is a serious task. Yeah, so cardio diseases, cardiovascular heart diseases, cancer, and HIV, they're pretty large in terms of the number that we have in the structure of the people diseases. So this is one of the very challengeable issues, and especially in terms of the HIV. As I told, Ukraine is a leader right now in the all European region in terms of the HIV positive calculations. And yeah, and critical medical infrastructure is the final step, and that's it's also quite challengeable, because we can see it right now with the COVID-19s, and this includes not only the facilities that indeed are rich in Ukraine, however, the quality of these facilities could be and should be questioned. Also, it is a level of doctors, it is a level of the medicine education, of the health education, and also the issue of the public support of these reforms, of these steps that should be done. So it's more about the overall medical infrastructure, medical atmosphere that should be stabilized in Ukraine right now. So yeah, so here we can see that if you're interested, yes, in this topic, so please read these articles that will show you how you can how both the healthcare system is developing in Ukraine, and what is the importance of the public policy, like to work with that. Because once more, unfortunately, we don't see these tremendous developments, and this should be clear political task for any of the government to work properly with that. Without government, without clear policies, we can see that no tremendous changes will be applied. And this is a serious task for current Ukrainian policy making. So thank you, and see you next class.